Okay, so good afternoon, everyone. Good afternoon.
Yeah.
Do we have a Ileleji Consulate?
Yeah, Ponslight, I'm here. Good afternoon.
Good afternoon. Okay, so we're just four on the platform, and I think it's already 5 p.m. over here in Nigeria. So I think we need to start.
Okay, yes. Yeah, it's 4 p.m. my end. Yes. Okay. I'm good to go.
Okay, so basically, I think we need to look at the agenda for the day. Do we have the agenda currently with us?
Dr. Bernadette just sends me the Zoom link. She didn't send me an agenda.
Okay, so is it possible that you share the agenda with us? Is it very much possible for you to share the agenda with us?
The agenda that I have here on this something was introduction of research, guidelines and templates for baseline mapping of country health systems.
Okay. I think we all should have it because it was shared on the Telegram group.
Yes.
Right?
Yes.
Okay, so
the agenda is there on the Telegram.
Okay, so we need to just start up. Basically, what we're doing is to map out an area where we will now concentrate on, probably have a focus on. So that's what we want to do right now. And if you're aware, there's been this survey that we shared with majority of us. We shared it that we should all respond to the survey. That's more of a mapping the particular thematic area for us to concentrate on. I believe we all responded to it. Did we all? Hello?
Yes.
This is my first meeting, please. I just got invited, so I'm catching up.
Okay, so basically we have six. The last meeting we had 6 thematic areas which we need to look into, and it was decided during the meeting that we should take it bit by bit. So we have to prioritize the particular thematic area to work with, so we don't have to work with a whole lot of programs without achieving anyone in particular. So we made a decision to create sort of a medium of each individuals from various countries, look at the health systems within the country, and then look at the basic ones which we will need to prioritize and make a choice. Then from the analysis, we'll be able to conclude which one in particular to look at. So we came up with different response. So basically from the response we had, I was able to analyze this. So I'm trying to share the slide with us. I'm coming. Can we see my screen?
Yes, we can see your screen.
Okay, so So like I said, we have 6 thematic areas which we were asked to make a choice from and then prioritize it based on the basic need of our various countries. So first of it is the mapping of diseases and the relevant measurable outcomes, including infectious diseases, mental health, non-communicable diseases, and injuries, sexual and reproductive health, neglected diseases. Then development of practical guidelines from the ethical to technical domains, information governance, data generation, data sharing, data safety, and cybersecurity. The third is the diagnostic toolkits for disease monitoring by community health workers. Health service delivery implications and impact of digital health, including regulation, utilization, workforce, and financing. While the fifth is governance and financing of digital health system, including relationship with non-health, multi-sectoral, private, and political actors for health. The last is competencies and skills recommendation for community health workers. So this was the systematic area for which we were asked to prioritize on and take it by preferences, considering our strong.
Sorry, the screen you shared did not show the topic.
Are you seeing my screen?
Yeah, we are seeing the screen, but it's a
We are
Okay,
seeing your
now-
screen, but it's
Okay,
very it's showing.
It's showing,
It's
right?
clear. We have response by gender.
Okay, so
Now-
now based on our selection, so we had 9 people who send in responses as regards to the prioritization that we did. So based on gender, we have 4 male and 5 female who responded to the question. And then we have, based on the country, we had 1 from Ethiopia, 1 from Germany, 1 from Somalia, and 1 from 6 from Nigeria. So now this is the table showing the thematic health system prioritization. So if you look at it, you will see the 9 respondents in the column. So you look at the first one, you see them by row, and then by column, you see the priority areas. So from there, you see that for response 1, the first person who responded had 2 as the most prioritized HS within the country. So when we did the breakdown, the priority 1, 2 respondents selected from it, we had 4 and 5. 5 is an outlier being that we had 2 persons selecting 5 as priority 1, and when 1 person selected it again as priority 6. So if you look at the priority 6, you will see selected 5 and then selected as priority 6, and then selected 5 again as priority 1. So basically, this is an outlier. So from the assumption, it shows that 4 becomes the most prioritized HS for various countries. So on that note, we came to the conclusion that we're going to work with the number 4 of the HS system, which is the health service delivery implications and impact of digital health, including utilization and workforce and financing. So that's the most prioritized HS for which we'll be working on. So then the second most prioritized from the analysis is the development of practical guidelines from the ethical to technical domains, information governance, data generation, data sharing, data safety, and cyber security. The third most prioritized is governance and financing of digital health systems, including relationship with non-health, multi-sectoral, private, and political actors. The fourth is the competencies and skills recommendation for community health workers. The fifth is on diagnostic toolkits for disease monitoring by community health workers. While the last one is the mapping of disease and relevant measurable outcomes, including infectious disease, mental health, non-communicable disease and injury, sexual and reproductive health, and neglected diseases. So basically for this particular research that will be conducting across sub-Saharan Africa and comparing it with other Western countries, we will be working with the health service delivery implications and impact of digital health, including utilization, workforce, and financing. So okay, so let me share the framework of the study. The idea, if you look at it, we are not that much on the platform, right? Hello?
Yeah, I get it.
Yeah,
Yeah,
so
we can hear you.
So if you look at it, we are not so much in the platform, and we intend to achieve a sub-Saharan study that would compare across each African countries and across some Western countries. So I would love it if there's a way we can actually bring in some persons on board. If we have friends from other countries, we can probably introduce them to this, and we can let them know, because it is important that we also get them review their literature on this particular area of study within their country. So on that note, this is the framework. I believe you can see this.
Yes, you can see.
This will be shared with
Yes.
yes, this will be shared with everyone, and this would form our document for literature review, for which we will send in our literature, which will be collected across each country. After which we'll now look at the study approach for which we would engage the stakeholders within the country, within the various countries. So if it's possible, if we have kind of a mass of people from a different country, or more than one person from a different country, it would be nice we collect our works together, put it together, and then we'll put it in this folder, in this form, and send it to a particular mail for which we would collect the all responses and literature reviews. So based on it, you can see the title, the first title, which is what we'll be working on. Health service delivery, implications and impact of digital health, including utilization, workforce, finances. So this would form the first study for which we will be working on. So hopefully with time, as time goes on, we'll be looking at other area of thematic health system across sub-Saharan Africa. And we'll be also looking at ways for which we can get fundings for these topics, for this area. So now you're going to tell us your name. You're going to tell us your name. You're going to tell us your positional details for yourself. That's for every individual who is involved. So if for a country, we have more than 2-3 persons, so it's expected that you put down your name in this first place where you said, tell us your name. So you put your name there, you put where you work currently, and then you collect it together. So you put it together. If you have 4-5 persons, you put your name in that place and the various places you're working. Then you tell us about your country health system. Give a little the structure of the country's health system. So like we said, every country has different operations, the area of operations. So like in Nigeria, we have the federal, we have the state, we have the local system. So we're going to pull this together, and that will form the health systems for Nigeria. So also you that are in Somalia, Germany, and other countries. So you put your health system together, and then you put it in this particular column. So then for the background, so basically what we'll be talking on now for the background is we're going to restrict it based on the health service delivery implications and impacts for digital health, including the utilization, workforce, and financing. So basically, we're looking at the utilization, we're looking at the workforce available, we're looking at the financing availability. So, this is actually a challenge when you are looking it from the hand of the sub-Saharan and the low-income countries. So if you look at recently, the COVID-19 actually really did show that even the Western countries, it's not easy for them to have to combat the disease. So it was a little bit cost intensive from their hand. So we will look at health system based on financing, based on utilization, and based on availability of a workforce. So then we talk about the problem statement. So you're going to state the problem solely from your country on this particular health system challenge that we came up with. So now we have to let's review literature. We're going to review the web links, reports, compendiums, articles, stories, radio, television, policy document, laws. So this is a table where that will form your template for which you're going to review the literature. We have the column for the author, the title, that's the type. The literature, is it a literature? Is it a law? Is it a standard operating procedure? Is it a policy document that speaks towards the selected HS challenge? So we'll talk about the relevance to what level. Is this law relevant to the national? Is it relevant to the district? Is it relevant to maybe the local government, like we have here in Nigeria? Then you talk about the relevance to project, what was said. So what in particular was said in the literature that probably speak towards the challenge for which we're looking at. So you put it in this part of the column. So now all source documents must be compressed. So we're going to have to compress every source document, and you can share it with the website. So probably I'm still going to have to add a mail for which would include the documents too. So we have to probably send it here and copy the other mails and send to the two mails. So these are the instructions on what to do. The mapping of the documents. So these are the kind of documents we're looking at. This will include all documents that are relevant. That's on misuse of resources, including staff, absenteeism, rent seeking, poor governance, corruption, accountability mechanism, and regulatory framework for addressing corruption, broader governance, but with repercussions for corruption and that impede the successful functioning of health system. So these are what we are going to look at: the laws, the regulations, and documentation in that area of selected health system. We look at the standard operating procedures and guidelines at all levels that are relevant to both the district and local level. We look at the historical background, the legal background, the administrative framework of this area for which we are studying, the research, the in-depth analysis, journalist accounts, other documents to be identified via snowball technique. So we all know what snowball technique is. So process. This will include the following steps. So identifying, appraising the document in terms of relevance, criteria to be determined, classifying and annotating them in the attached template, describing the relevance of the project. So this might actually be apparent, right? So you may not give a very lucid or clear thoughts to what we're studying, but it's a bit passive. Whatever literature you're bringing should have something that has to do with what we're studying. So then note, it is important that country teams organize each other. So I said this earlier. So if you're more than one person in your country, you pull your documents together and then you put your names and your organizational details and of those who contributed to the literature review, and then you include important documents referring to the issues under discussion. So you're going to send this framework, and then you're going to send the literatures for which you review. You're going to send the links for which, if it's a web link, you're going to send it on the template for which I previously shared with us, which is this. So you're going to put the links and in these places, and you're going to compress it with the literature and send. So for each country, there's a particular way for which you're going to name your document. So naming of compressed document. Documents should be named using the country's name and then HS underscore HS. Example, I said Germany underscore HS. So basically, this is what we're going to do for the next 2 weeks. So let's do it for the next 2 weeks so that we can put our work together and hopefully come out with something. So after we've been able to develop the literature, we're still going to have another meeting where we now discuss on the various methodologies for which we work with. So we're going to discuss this. This will be an intensive. We're going to share the document with us, and each of us will look at the document and conceptualize the document, and then after which we meet and then we deliberate on the study design for which we'll be using for the study. Then we can then go back to our various countries and then look at the mapping of each stakeholder that we're going to interview for this purpose and get the data for the analysis. So basically, this is just the framework for which we'll be using for this first research study. Thank you. Hello?
Yeah, I get you.
Yeah, so
Very good.
So do you have Dr. Bennett on?
Yes, thank you. Thank you, Glory. I'll just try to park on the side and listen now. So I'll just wait here till we are done. Thanks for the great work already. And so maybe let me allow the others if they have questions to ask while I get ready to recapitulate on the past meetings.
Okay.
What I want to ask Gloria, thanks for the presentation and it got me up to speed. I just put my email at the corner there. Whether you have this as a Google Doc, somewhere where folks can just be putting stuff in, I don't know yet.
So we're actually going to share this on the platform with our mail. So like you said, you just dropped your mail and we're going to share it on the mail. We're going to share it on the Telegram. So, and like I said, from various countries, if you're more than one person in the country, so you can meet at a point and then deliberate on the particular area for which we're looking at, and then put your works together. So this document will be shared with every individual on the platform.
Thank you.
You're welcome.
So regarding the sharing of document, I just applied last week from the Microsoft Office for NGOs. So the moment the clearance is out, because since they have to investigate the status, then I'm sure it will be we can then establish a more official platform to easily share documents with everyone. So we should not overuse our own private drives.
Yes.
Mm-hmm. So I'm sure since yes, so that I just hope that they said 2 weeks to investigate, to get to see through the non-profit documentation, and then that should also be done. Yeah.
Okay, so while we're waiting for the 2 weeks, we can as well share this first.
Yes.
And then by the time we are now retrieving the document, so I believe by then they would have approved of the share.
Yes. So I'm having difficulties to connect my screen. Maybe I will use another telephone to be able to pick up. But from what I get now is so we are going to okay, what I wanted us to be specific about also, Glory, was that, for example, the country of residence and maybe the country of interest might be two different places. Okay, I'm
that's what
resident
I'm
in
saying.
Germany.
Yeah, Paul.
Yes, I'm resident in Germany, but my country of where I want substantial information is Cameroon. Sometime later on in time, I might also have I'll do something on Germany, so we have comparative analysis, so that at least our focus should be first mainly on what is happening on the continent, and then when we have what is happening on the continent, then we can then embark on having something, because the system in Germany is already well advanced, but the basic structures are somehow similar, but there are many other things that might equate that differently. So I just wanted us to include that in the protocol also.
Okay, that's fine. So, but we are looking at the accessibility to these documents, and then accessibility to the stakeholders on ground. So,
yes,
because by the time we now get a study site, but probably get the study design, we will need to be on ground to be able to capture responses from those stakeholders. So it's fine since you live in Germany and you can actually get information from Cameroon. It's fine. So it means we can also include that in the study protocol. Hello?
No, I'm here. I'm just
so
trying
I'm looking at considering what we're doing, we may also need the ethical clearance from the various countries which we'll be working at. So if it's possible, we share the protocol as well and attach a proposal to it and share with everyone so we can take it to an institutional board in our country to be shared among them so they can give a permission to carry out the study.
Yes, so that was the next point that I wanted us to discuss on, that we have to have a project protocol, and then so that at the end it will be easy for people to apply for, if it is just basic research, generally, if it's just basic review, before, see, if we are not doing any specific interviewing, then we might not need ethics.
Ethics, yes.
Yes. So, but for moving forward, we certainly need ethics. So it is better we prepare a protocol, and the protocol. So we have two things. One, to have a protocol for the project, and because it will also enable us to recruit partners from the academia.
Yeah.
To say that, okay, which universities are willing to participate, and then so we can have something to present to them. And then on the other hand, we have now a specific protocol, depending, because when you have a project protocol, depending now on the specificities of each country, it will just be copy and paste into the forms.
Yeah. So that's fine.
Yeah, so that is where we pick up from. I just think one point on the agenda was to recapitulate on the previous meetings, but since I'm not at home and I cannot work with my computer from the car, it's actually basically we are actually at the beginning still, but since I just wanted to have an introduction on why we are doing this exercise, because the essence of the community digital health hub is to be able to come out with recommendation and have so that if tomorrow anybody who thinks, okay, this is an area where it can be an innovative platform, but we are trying to generate evidence for digital health from the continent perspective, and from why and going continental, it also assists with the African Union premises of trying to have open borders across the continent. So, and that aspect of ethics is very important, the aspect of data management. So those are the things that I just believe anybody within the digital health space, it is important to know if I'm preparing, if I have an innovation, if I have a concept that I think I want to strengthen the health system, I should think in a futuristic manner. If somebody leaves Cameroon and visits Nigeria, the doctor there should be able to read, also have access to the person's health information. But so now that question of who owns the information and who has the right to forward people's information, those are all the things that we think that it is necessary, but we are taking baby steps. And I'm very open to, as just like Glory said, all of us to try to invite many friends as possible, or other collaborators. We are willing to share all the information. So please invite people that we think we can try to have an open discussion and a scientific and academic discussion on these things before people actually start creating companies that maybe at the end of the day, because we have young people that would like to have startup, but we already see coming up with research, it is some sort of cost. So, but if there is evidence that is available already and somebody has an idea of the shortcomings of, for example, primary health care, why are people not visiting primary health care? That falls within the health service analysis. So if I say my intervention the intention is to strengthen primary health care, and I do not do the due diligence of why are people not using primary health care? Why is it that many people prefer to leave and go and congest the general hospitals, but the primary health care get lost somehow? So if we do not understand why people are not using that, and I come now with a digital platform to assist in that area of primary care, I'll still fail. So that is why this evidence-based implementation strategy is important. It is not going to be an easy exercise, but I just feel from my own perspective that it is something that is necessary. So I don't know where you people stand on that, and what you think. Especially, let me talk to Ponslet, who is more of IT. Maybe he can introduce himself shortly and then just tell us about what he thinks, how the digitalization in the health sector can best be implemented within the continent.
Thank you very much, Benedict. I'm Ponslet. I'm the CEO of Joko Labs Banjul. I'm a computer scientist by profession with over 25 years in the field, focusing mainly on innovation. I do a lot of stuff too on health informatics because my second master's is in health informatics from University of Plymouth. So what I feel is important in this particular project is in regards to data protection and privacy, because those are health data. Data is the new oil, as we all know. So health data is very important and how it is used, you know. So the good thing is that people talk about having data centers to host all these different type of data, you know. But one thing that is most important with public health data, you can use it for a lot of things, especially if we look at what is happening now with this pandemic. You know, you just get, we have figures from some countries have really not been able to even give figures of how many people have been vaccinated, you know, because of the way data is being collected. Okay, if they have been vaccinated, what is the age demographics and all these sort of things. And all these data are very important for us to be able to make very informed decisions within our public health care. And I think cloud-based, robust cloud-based solutions, whereby we won't be thinking of anything or something has happened and then the data disappears. So there are a lot of robust cloud-based solutions that we can use for it. And but for that to also happen, most of the public health workers who are the bottom tier of grassroots level in our public health centers as grassroots level, there has to be capacity building for them, you know, to be able to upload data and use all these things. And all these data, are just simple forms. You can design a whole simple mobile app that is all integrated, that once the data is uploaded, you can be able to then decipher that data and analyze it analytically. So that's why we stop here, but the data protection and privacy are key within a cloud-based solution. Thank you.
Yeah, thank you, Ponslet, for that.
So any questions to Ponslet?
Okay, yeah, Ponslet, thank you so much. Like you rightly said, so that's very key to this exercise. We need to take it very serious. Data is something that we don't just let it flow like that. So we need to restrict it to the particular people who need it, who are in the study, to be able to use it in the right form and not just letting it out to people. So we're actually going to come back to that, because by the time we are able to put our literatures together and then we come up with it, if it's a literature review, we would need to get somewhere where we can probably put this information so it doesn't go out like that, except only when we're required to. And if it's something that we need to interview people, like a questionnaire, there will be need for data protection. So thank you so much for that.
So then Curtis. Curtis is our student researcher. You have any questions that you think?
No, for now, I don't have questions for now. Thank you.
Okay. So if that's the case, Mr. Glory, you have anything that you think that we can discuss still today?
So basically, I was going to ask, from the responses we actually got, it was not a bit, it was not something encouraging, so it was a bit poor. So we need to look at a way that we can actually bring about response to such programs. So if there are platforms we can share this, if it's a research, if there are platforms we can tell our friends, discuss it with our colleagues, it will really go a long way to having people who are research oriented, pulling them together. And we need to really look at research in Africa, or basically in low income countries, is something of a challenge. So we really need to work with that. And I was also looking at the area, you spoke about it. I was looking at the area of getting research into policy and practice, whereby we don't just have these things in a shelf, lying low, lying without being used, lying there without being used. So we need to also develop a sort of a team within the country where we can meet with stakeholders, not waiting for them to come to look at what we've done so far, but taking this research to them where it would inform policies and practice. We put it in the form of a draft. Research is a bit bogus, so we can put it in form of a draft, a summary, or a fact sheet where we can disseminate it to them, meet them at the House of Assemblies or House of Reps, and then get them to use this data, get them to practice the usage of data and not just piling them. That's my take.
Okay, thanks. Yes, because I was also wanting to propose that maybe we extend the period of the survey. See, remember we shared it only last week. So maybe we can extend it up till the next meeting next month. And within this time frame, we try to share out of, we try to invite, we try to share within our networks and get more people to participate on this.
No, I think basically from the survey, what we've done from the survey, we've been able to, irrespective of the responses we got, I think the issue, the challenge we came up with is something that is a bit differential, something that I can see basically all Africans have issues as regards to that area of a challenge. So where they should come in now is where we need to bring up people is to get them to, as in build up literature around this study from various countries. So that will be the next step to take. So for the survey, I think we should forget about that for now and focus on the literature review. So we need to get various countries to bring up their literature review. So I think we have a sort of we share a kind of a platform on Telegram. This immunization, Geneva immunization. I think that was where we first met. So if somewhere like that, we can actually invite people from different countries to share their literatures too. So that would be nice too.
Okay. So what you are saying is the next step is that we should draft a summary and include the research areas, and then we can then share that part. So not going back to the survey, but now this yes. Okay.
Not going back to the survey, but sharing the documents with people to read literatures and then get their own country perspective as regards to the topic.
Okay, then that would be great. Will it be possible for you to draft the one pager so and then I can ask for permission from this person to share, because most for us the one people we need to have ask permission to share documents there.
Yes. So someone like Reda, you know Reda, right? Reda, you can ask for Reda's permission.
Yes.
Probably he could share that, so Reda could probably talk about it a little and then let people, I believe whatever comes from Reda, people tend to give it a yeah. So when he speaks about the research, so we can actually have a lot of responses from people as regards to the literature.
Okay, then that would be great. So the two of us will liaise over the week and then they'll come up with a strategy. Yeah.
Okay.
No, thanks. Yeah. So if there are no more open issues, then I would just like to hit the road now. I hope I'll arrive my home because the traffic here is getting. I was hoping that now that with the lockdown, many people are not traveling, but many things are open now in Germany, and some states are already on summer vacation. And today is Friday, so it is not getting easier, anyways. But at least I'm happy for this past months for being able to work out of home. Yeah.
Okay, so I think we were spoken at length and we were shared all we needed to discuss with every participant. So it's fine. We don't have to wait till 6 p.m.
Exactly. Nice meeting you, Gloria and Kalitis, and I look forward to getting information on mail and being joined on the Telegram.
So, Ponslet, are you on the Telegram?
No, I'm not yet on the Telegram.
Okay,
Yeah.
so I have your mail now, so I'm going to share the link with you.
Okay.
Or if it's okay, fine. I will share it with you on your mail.
Yes. And I can just put my mobile number.
Okay,
Also
that'll
here.
be fine. That'll be fine.
Yeah. So for my Telegram, so I have put it. Have you seen it?
Yes. So basically, Ponslet, you're going to be in charge of our IT.
Yeah, no worries. No worries. I will do my best to support. The rest assured I will support accordingly. Yeah.
Okay. Thank you so much for coming on board.
Okay.
Yeah.
Thank you.
So everyone,
you all
do have a lovely evening.
For you too, everybody take care. Have a nice weekend. I'll catch up with you people over the week also. Yeah.
Okay. Take care. Take care.
Yes.
Bye.
Yes.
Bye.
Bye.
Bye.